I met a surgeon that does something that's a little bit different. He's been on with Dr. Oz and also with Tom Joyner to kind of talk about this in the past. And he's a surgeon. It's Dr. Rosser is here. He's a surgeon, and they do something that's a little different. They kind of hello, how you doing, doctor? What's going on? We'll just set him right there. I'm going to take her back there. And Dr. Rosser, we appreciate you coming in. And I met you at a party one time, and you were telling me about what you do. And let's go ahead and turn his microphone on and get him some headphones. There you go. Hello, Dr. Rosser. How you doing?
Hey, what's up, my man? How you doing today?
Hey, man, it's nice to meet you. You are a surgeon, and you do something a little bit different. I know you've been on with Tom Joyner and with Dr. Oz. Tell me about being invited to Dr. Oz.
Well, it was pretty cool. My friend Tim Sullivan won a couple of awards and covering me when I was in New York, and Oprah chose him to be the head of publicity. So Tim said Melvin and I had to hook up. I knew Melvin before, in our circles, but then we really hooked up because he has been on the forefront in, just talking to the public and letting them know what's going on with themselves. Uh-huh. And I did a show back on the Learning Channel called The Operation, which was the first medical reality show.
Oh, really?
Yeah, in 1993, we won a Telecommunications Academy Award for that back in 1993. So I have a lot of documentaries to educate the public. He obviously has the #1 show in America, and so we started hooking up. And
I'm curious, how do you make that cross? I mean, okay, if you're a surgeon, mm-hmm. and then you have the opportunity to do some television, like what ends up being a little more, I don't know, glamorous, or what is it that attracts you more? Is it being the surgeon, which most of us think, oh my God, you're a surgeon, you're making millions, and you're living the high life, but being a TV star, you got a little bit of notoriety. Which one is more glamorous?
Well, really, I think it's an unbelievable fusion because you and I have common ground. Mm-hmm. Remember, we both started off at GJ's.
Right.
Yeah, I was the Delta dude from the University of Mississippi, playing the blues songs. So I've always had that thing with the public like you have and you guys have, so brother. Mm-hmm. And so I said, look, the way we're going to help people take better care of themselves is to empower them. I got a lot of criticism when I showed the dirty laundry behind medicine and the nitty gritty and empowering patients. And for me, the best thing is not only helping to heal patients like I'm going to do a little bit later this morning, but educating patients to take care of themselves. I just believe in transparency, Russ, and that's the only way we're going to change this world, man.
So you got surgery today.
Yeah.
So when you wake up in the morning, you got to go cut on somebody. You got to go work on somebody. You nervous, or is it just another day at the office?
No, it really is another day at the office. Like playing football, you go and work and you go through all those repetitions. And see, I train. I'm always training. I mean, I'm always making myself better. It's more for me like an athlete, especially what I do. I look at the TV screen and play video games all day. So I don't open you up. So my technique is being able to perform these modern day miracles.
Oh, so you use kind of a robot as well?
Yeah, robotic, and then without the robot. Either way, you got to work on a screen. And so you train yourself. You don't fall out the womb being able to do this. So just like a great point guard, just like LeBron, I'm always up in my game. I'm always innovating. And that's what keeps me just pumped every day because it's a beautiful time to be alive.
So, the reason I asked you is because you were telling me about this new thing that Dr. Oz asked you to come talk about. And we were talking about heartburn. And Dirty Jim had a question about heartburn, about whether it's a prescription or over the counter. What was the question, Jimmy?
No, it wasn't a question. When you said prescriptions, I said, and Kevin said heartburn, like Prilosec and all those Zantac and stuff like that. Those are over the counter drugs. Those aren't prescriptions from what I understand.
Well, that's true. But then we have a lot, as Russ said, that are still like Asafax. There's still a lot of other drugs. When they talk about these drugs, they're actually talking about a family of drugs, and we spend that much money on a family of drugs.
Like $13.6 billion.
Look, that's a lot of dead presidents, homie. That's a lot of dead presidents. And the bad thing about it, Russ, two things that the public doesn't know. First of all, they're taking these drugs and it's not curing them. They think the heartburn's going away, but the acid is still eating at their food tube. Right. The second thing that we found out now, Russ, all the complications, hip fractures, diarrhea, something called C. difficile colitis.
From taking the drugs?
Taking the drugs. Pneumonia. Yeah. Community-acquired pneumonia. Yeah. See, now these drugs, they not only can be bad for you and have side effects, but they're not taking care of the problem. And as Oz said, the fastest growing cancer in America is esophageal cancer, and it's from heartburn and gastroesophageal reflux.
And a lot of
disease.
people have heartburn. A lot of people have to deal with it.
Look, man, like you said, 42% of the nation has heartburn once a month. But then the bad thing is about 7 to 21 million people have something a lot worse where they suffer every day. And that's gastroesophageal reflux disease.
Okay, so what you do, and I'm a layman, I don't know what I'm talking about, but from what I saw, you've got some little new technology kind of a thing that you implant inside the esophagus? Is that what?
Well, yeah, because see, the medicines aren't working. The public doesn't know they're not working, and even the doctors aren't giving the public the information that surgery can be a true answer.
So it's like a valve at the bottom of the throat or something?
Well, this is what happens. You have your food tube coming down, connecting with your stomach.
Right.
But there's a door. And that's called, it is a valve, the lower esophageal sphincter, that basically is meant to keep the food in your stomach, in your stomach.
Right.
Well, for a lot of us, that doesn't work well. So all our operations that we're doing, and thank God we're doing them without opening you up now, is meant to support that valve. Now, there's 2 operations that we do to support the valve. The older one that's tried and true that I've been doing is that you take the top part of the stomach, wrap it around that lower esophageal sphincter that's weak, and then kind of give it a little turtleneck or something, and then that strengthens it. Well, the only problem about that is it works, and people haven't been getting it, but the problem is they say, well, I don't want my stomach rearranged. That's cool. I can understand that. Now we have these magnets. So
you put magnets inside them.
Exactly. It's a I'm looking at my Urban Rock bracelet here. It's my favorite bracelet. Now you see these little magnet balls connected by this thread that will slide over your esophagus. Okay. And when it needs strength, it gives it strength. When it needs to
the magnets pull it together.
Exactly. But they also loosen. And that's a lot more comfortable with folk, because a lot of people say, well, I don't want my inside rearranged, or I only want it rearranged at the last, at the last resort.
Yeah.
Are you you're an ENT?
No, I'm not ENT, but I'm glad you brought the ENT piece up.
What's an ENT?
Ear, nose, and throat.
Okay.
Usually when you deal with acid reflux, the ENT is the person you would think. Like when I had my issues with my throat, my polyps in my throat, I always thought, well, I got to go to the throat guy or whatever the case may be, or it was something else. They said, look, your problem is acid reflux. You lay down at night, the acid in your stomach comes up your throat, causes irritation on your vocal cords, which leads to the breakdown of the mucus that covers them, causes some fissures and some other issues. When those rub together, they create a callus that creates a bad throat. Then that's why the first set of therapies for that is a therapy or a prescription for a powerful, like a stomach medicine that kind of reduces the acidic nature of your stomach contents.
Exactly.
And then if you don't get that, you have to go to some other stuff. Like Otto had to have something like this happen too, because he has bad acid reflux, and it can be really bad for you, like the esophageal cancer issue.
Yeah, exactly. And I tell you, I'm so glad you brought that up, because that is what we call the silent face of reflux. Hoarseness in the morning, feeling like you can't finish clearing your throat, post-nasal drip. Did you know that 40% of asthma in this country is caused by reflux? And people don't have the usual symptoms of, like I said in Tom Jones, Tom said, well, Butch, Dr. Butch, tell me what kind of symptoms do you have with reflux? Well, I said, Tom, okay. All right, I'm a Mississippi boy. I've gone home. My mom fixed me some catfish and grits. Then I get the Louisiana hot sauce and I eat it. And then all of a sudden, about 30 minutes later, I'm feeling this burning in my chest.
Fire.
Like fire.
Yeah.
Hey, that's an old song. Don't.
Earth, Wind, and Fire, right?
Earth, Wind, and Fire, yeah. So now you got fire in your chest. You start swallowing, you start regurgitating, and you think you have a heart attack.
And heartburn has nothing to do with the heart, does it?
No. Heartburn has nothing to do with the heart, except we now found out one of those silent symptoms is that having heartburn can mimic heart pain.
Okay.
So sometimes people get to the point where they actually can mimic heart pain. And these magnets, see, we were hoping to get more people to have the operation. And then
because if you have the magnets put in, if you have the magnets, then you don't have to take the prescriptions, the medication, and it might be better for you in the long run.
Well, yeah, because we know even when you're on the medication isn't stopping the acid from reaching certain levels. You think you're cured and you're not, and that's how we're getting esophageal cancer.
How new is the magnet operation? I mean, is this something that is and how many years of testing do you have to do? Do you test it on a monkey? Do you test it on a mule? How do you test it?
Well, what happened is they had Europe and the United States. It's been about 6 years. They have like 600 patients around the world. They followed extensively. So the FDA has cleared it. They actually are just starting to do the operation, and we're blessed.
So you're just starting to do this operation.
Yes.
It's new to the country. That's why I thought it was interesting, because I knew it's unusual.
It's new. So Celebration, our hospital, is one of the hospitals, along with my friend at the Florida hospital, the big Florida hospital, Steve Eubanks. We have been selected to actually offer this to the public.
One of the few in the country.
Yes, one of the few in the country. We have Jacksonville and Tampa and one in Miami. So they're trying to bring this out in a controlled fashion. But the big thing I want to make sure we go over here today is our what we call Operation Bear Hug coming up on Thursday.
Operation Bear Hug.
Right. And I got this from Oz, too, being with Oz. He had something called the 15-minute physical, and it was so successful around the country. We brought it to Tampa and the Adventist Hospital there. So I said, look, we need to have a 20-minute heartburn checkup, Operation Heartburn, and we're going to have that Thursday, 6 to 9 at the Nicholson Center on the campus of Celebration.
Okay.
And so you can come in if you think you have a problem. First of all, go to our website, www.celebrationsurgeons.com, to register, and then come by and we can give you a free 20-minute heartburn checkup. And Oz, it was so important. Yeah,
That's
right,
good.
Right, yeah. So we're trying to reach out to the public.
Good benefit for the listeners. And if you're suffering from heartburn, you could call Celebration. Go to the website. Once again, what is
it's www.celebrationsurgeons.com.
All right. Dr. Rosser, I know you're a busy man.
Butch. Call me Butch.
Butch, all right. Butch is fine. Yeah, he's a good fella. It's good talking to you, and I appreciate you coming in. Because once again, a lot of our listeners I know may have this and not know there's a alternative to to the prescription.
Look. Put this in perspective. If 60 airplanes went down a year with 250 people on board every year, that's how many people die from esophageal cancer, and that's approaching, what we're losing on the highways in this country. This is a serious matter, Russ. I want to thank you and Monsters, and you guys are a sweet crew. I was rolling with you even when I was out of town. So thank you, and keep up the good work, my man.
Appreciate it, Butch. All right, you take care, buddy. You're listening to the Monsters in the Morning.